What is anxiety? Anxiety is a feeling of fear, dread, and uneasiness. It might cause you to sweat, feel restless and tense, and have a rapid heartbeat. It can be a normal stress reaction. For example, you might feel anxious when faced with a complex problem at work, before taking a test, or before making an important decision. It can help you to cope. The anxiety may give you a boost of energy or help you focus. But for people with anxiety disorders, the fear is not temporary and can be overwhelming. What are anxiety disorders? Anxiety disorders are conditions in which you have anxiety that does not go away and can worsen over time. The symptoms can interfere with daily activities such as job performance, schoolwork, and relationships. What are the types of anxiety disorders? There are several types of anxiety disorders, including generalized anxiety disorder, GAD. People with GAD worry about everyday health, money, work, and family issues. But their worries are excessive, and they have them almost every day for at least 6 months. Panic disorder. People with panic disorder have panic attacks. These are sudden, repeated periods of intense fear when there is no danger. The attacks come on quickly and can last several minutes or more. Phobias. People with phobias have an intense fear of something that poses little or no actual danger. Their fear may be about spiders, flying, crowded places, or being in social situations, known as social anxiety. What causes anxiety disorders? The cause of anxiety is unknown. Factors such as genetics, brain biology and chemistry, stress, and your environment may play a role. Who is at risk for anxiety disorders? The risk factors for the different types of anxiety disorders can vary. For example, GAD and phobias are more common in women, but social anxiety affects men and women equally. There are some general risk factors for all types of anxiety disorders, including certain personality traits, such as being shy or withdrawn when you are in new situations or meeting new people. Traumatic events in early childhood or adulthood. Family history of anxiety or other mental disorders. Some physical health conditions, such as thyroid problems or arrhythmia. What are the symptoms of anxiety disorders? The different types of anxiety disorders can have various symptoms. But they all have a combination of anxious thoughts or beliefs that are hard to control. They make you feel restless and tense and interfere with your daily life. They do not go away and can get worse over time. Physical symptoms, such as a pounding or rapid heartbeat, unexplained aches and pains, dizziness, and shortness of breath. Changes in behavior, such as avoiding everyday activities you used to do. Using caffeine, other substances, and certain medicines can worsen your symptoms. How are anxiety disorders diagnosed? Your healthcare provider will ask about your symptoms and medical history to diagnose anxiety disorders. You may also have a physical exam and lab tests to make sure that a different health problem is not the cause of your symptoms. You will get a psychological evaluation if you don't have another health problem. Your provider may do it, or you may be referred to a mental health professional to get one. What are the treatments for anxiety disorders? The main treatments for anxiety disorders are psychotherapy, talk therapy, medicines, or both. Cognitive behavioral therapy, CBT, is a type of psychotherapy often used to treat anxiety disorders. CBT teaches you different ways of thinking and behaving. It can help you change how you react to the things that cause you fear and anxiety. It may include exposure therapy. This focuses on having you confront your fears so that you will be able to do the things that you had been avoiding. Medicines to treat anxiety disorders include anti-anxiety medication and certain antidepressants. Some types of drugs may work better for specific types of anxiety disorders. You should work closely with your healthcare provider to identify the best medicine. You may need to try more than one medicine before finding the right one. Thank you for joining us here at the Chill Out Boutique. Please help us grow by hitting that like button and subscribing to our channel. Until our next video, remember to chill out and relax.